So welcome everybody. This is our third live Q&A that we've done so far. It's kind of new for us here in 2021. So pretty excited. We're getting better at it. I think this is the first one that we've started on time without technical issues. So we're getting better. This month actually, our theme is dental awareness. So we're going to be talking about dental disease in pets, kind of what that means and everything else. So throughout this whole thing, you guys can submit questions. We do kind of pause and answer questions as we're going through, just to make sure that's kind of the point of this. If we're not getting any questions, I do try to keep talking, come up and answer some of the most common things I get asked all the time, just to give you a little info about dentals. And as far as next month, that's our dental awareness month, and so if you go to our online store, you'll see some things on sale there. We do encourage you to check that out. And it's got like chews, mouthwashes, all of those types of things. Okay. So just to kind of start, okay, so dentals, pets always have historical, the dog breath out there that everybody always talks about. Dog breath is actually bad breath, and it is usually associated with dental disease. Was it a big deal back in the past? Not really, but our dogs are living longer and longer now. So when they get those bad teeth, we're starting to notice a lot of the overall health concerns that go along with that they've documented forever in people. Okay, so they know that if people have really bad dental disease, they are more prone to lung infections. They are more prone to heart disease. And they have a lot of sinusitis problems. You can also see it associated with eye problems, chronic ear issues, pretty much anything from the neck up. You can associate that back to dental disease, can be one of the contributing factors. Okay, now there's lots of other things that can play. Just because you have a chronic ear problem does not mean it's the teeth, but it could potentially be playing a role. If you have bad teeth and you have bad ears, potentially taking care of the teeth could help with the ears not coming back in the future, those types of things. So it has been associated with it, it has been linked to it. And then the chronic sinusitis, respiratory disease, if you're breathing in all that bacteria, it gets put into your airways and it can set up shop as you're going through all of that. The chronic snotty noses, those types of things. We see that mostly in our cats that have the chronic snotty nose. Now, a lot of times it is herpes virus, which is a respiratory infection in cats. Once they get it, they do have it for life, so it will flare up occasionally. But sometimes the teeth are playing a role as well. And if we address the teeth, a lot of times they do feel better, they're able to breathe better, and you have a lot less of those issues that we chronically treat in these guys. So it does kind of play a whole role with the whole body. Why it's becoming more and more of a thing is because our pets are living longer and longer. And so we're starting to see that all of these things are interconnected and they work together. So a couple common things that we get asked a lot is kind of how important is dental cleaning? Well, again, that kind of goes back to how long is your dog going to live? All of that. Does he kind of clean his teeth himself? Dogs' teeth are different from people's teeth in the sense that they do not have a flat surface. Our dogs and our cats are carnivores, and so they're not meant to grind anything. So the teeth are kind of pointy, right? So where does the tartar build up? It doesn't really build up on the inside. The tongue does a pretty decent job keeping that clean. Where it builds up is on the outside, right in between the gums and the tooth itself. And so it can build up there. When that tartar builds up, it causes gingivitis, it causes inflammation. And then what happens is the gums, you can actually watch it happen, and they'll run away from the tooth. If you look in there and you get that tartar knocked off, you can actually see exposed roots hanging out there in the mouth of the dog. And a lot of times that is painful. So once you start to expose the inner workings, that's when that pain comes into play. In human beings, if you know anybody with human dental problems, gum recession, things like that, they always talk about tooth sensitivity. They have Sensodyne toothpaste and all of that. So we know that once those nerves get exposed, they do, communicate, talk, they can cause pain, they can cause sensitivities. A lot of times you won't notice, but let's say your dog has one bad tooth, they might just chew a little bit more on the other side. And we'll see that a lot too in the rooms when we look in their mouth. if it's pretty early on and they just have like one bad tooth, it's not a whole, mouth problem. It's just one tooth or something. You'll notice there's a lot more tartar, let's say on the right side of the mouth than on the left side. That's because the pet, he's not saying anything. He's just simply not using the right side of his mouth. They don't care. They don't mind. It doesn't really bother them. Our pets are really good about that. If they can find a workaround, so to speak, then they work around it, and it's not a big worry. All right. So those types of things you'll notice quite a lot. You can brush their teeth at home. You pick up a soft bristle toothbrush from the grocery store, and then you just use doggy toothpaste or kitty toothpaste. The biggest thing is to use pet safe toothpaste because there is no fluoride in the pet safe toothpaste. If they eat the fluoride in the human toothpaste, it is going to hurt them. That's why you're not supposed to eat toothpaste. You're supposed to spit it out and rinse it out and all of that. Our dogs and our cats, we know they're going to eat it. So we get them a special toothpaste that isn't going to have any fluoride in it, and a lot of times they flavor it. Beef, chicken, peanut butter, mint, anything your pet likes or you like, whatever you prefer to smell, usually goes over pretty well. The most successful way I've had introducing pets to teeth brushing is if you take a toothbrush, put a little toothpaste on there, and just offer it to them. They'll lick it off. Okay, it's just a vehicle for a treat. Okay, so then they start to like the toothbrush. And then as they're kind of eating off the toothbrush, you just kind of move it around a little bit at first. Don't try to get too aggressive with it. As long as that's going well, then, before you know it, you can move it around more and more, be a little bit more direct with it, and you're brushing their teeth. Again, as I mentioned, their teeth aren't like ours. So you really only have to worry about that outside surface of the tooth. So you don't have to sit there and pry their mouth open, make them say, try to get all surfaces, 30 seconds each side. Nah, just worry about the outside surface. That's where your problems run. Probably the hardest teeth to brush, from my experience at home, is the little incisors, because you got to go sideways. And they're always trying to eat the toothbrush while you do it. So luckily, the incisors usually stay fairly clean. Your big problems that built up are back here in the molars usually. So if your dog's really good and you get to a point where you guys work it out, you can get those incisors, all the better. But just do what you can. A little bit is better than nothing. Ideally, again, for toothbrushing, it is something you do every day. It's more of a preventative measure. If you get to the point where you pull up your dog's lip and you see all this big nasty tartar, this big nasty calculus, you could brush those forever and you're never going to get that off. Okay, that's where you would want to do a dental. So essentially you need to send him and have him get the tartar chipped off. Like you go to the dentist, they chip it off your teeth and all of that. We do need to knock our pets out for that. They're not going to sit in a chair and say for us. So it is an anesthetic surgery. It's a procedure. We knock them out. We get in there with an ultrasonic scaler, which is they also use in humans. And then we get all that tartar off. Then we polish the teeth, clean them up, all of that. And that gets you back to square one. And then a lot of times, if you follow up with teeth brushing and things like that at home, you're going to be really successful, and you're not going to have to do that often. And your pet's going to have good breath. They're going to have good teeth, and they're going to be healthier overall. Now, some pets will not let you brush their teeth. So how often would you want to do a sedated cleaning and dental at your regular veterinarian to just kind of keep up with it? Really depends on the pet, honestly. We recommend having the teeth checked every year, but some dogs build up tartar more quickly than others. So that goes back to that comment I made about if your pet kind of brushes their teeth themselves. So if you have a dog that's a really good chewer, and they really love to chew on anything they can get their mouth on, okay? So rubber toys, sticks, you give them the rawhides if they work well with those, anything like that. Then what they're doing is, as they're using those teeth, they're kind of breaking the tartar off as they just sit there and chew on these things. So our dogs who are really good chewers, honestly, a lot of times they don't need a dental that often. Now, there's a caveat to this, okay? There's that sweet spot in the middle that everybody loves, right? So if your dog doesn't chew at all, you're probably going to have to do some teeth stuff at home. If your dog chews all over the place, including really hard things like rocks, then he's probably going to need some dental care because he's going to break his teeth. Dogs' teeth actually have a third the enamel of human teeth. So with as much as they use their mouth, it's quite amazing they don't break their teeth more often, honestly. But they do fracture those teeth if they're constantly chewing on hard things. So if you're offering your pet something to chew to try to keep their teeth healthy, what you want to do is, I always call it the knee whack test. Okay? So if I take it and I whack it on my knee and I don't fall over and say ow, okay, then it's okay. If I take it and I whack it on my knee and it hurts, that's too hard, okay? That can fracture one of their teeth. So you're gonna wanna kind of do a knee whack test when you're looking at chews, things like that. So we did get a question here. If my puppy loses his canine teeth, do I need to do anything or leave them be? So as far as a young puppy losing baby puppy teeth, no, you don't have to do anything about it. He'll be just fine. If he was a dog in the wild who had to catch his food, what those canine teeth really do is they hook that prey so he can't run away. His kibble isn't going to run away, so he'll be just fine, even if he doesn't have any canine teeth for a while. If it's an older puppy, like an old dog who loses his canine teeth, kind of the same thing. We do have dogs and cats that will come and get full mouth extractions when they have really bad dental disease. And so they'll go home with absolutely no teeth. And at that point, you just soften the food until the gums heal. But then most people don't get dentures anymore because they're better about taking care of their own teeth. But if you ever do a grandma or grandpa or somebody with dentures, they'll pop out those fake teeth and they'll eat anything under the sun, which is the same thing with their pets. So once those gums harden, they can eat dry kibble. A lot of times some of them even like to chew on things again and just gnaw on stuff because it doesn't hurt. And that's the whole point behind doing the dentals, is just to get rid of that pain, get the pet comfortable, let them be happy with their mouth. I already answered that question.
Can't puppy lose their teeth?
Weird. Okay. I just answered that.
I didn't notice.
Sorry. Someone showed me the question that we just answered. We just answered the question about do I need to do anything if my puppy loses his canine teeth? It's a normal part of teething. The puppy canine teeth usually fall out somewhere right around 5 months, and the adult canine tooth comes all the way in, usually right at about 6 months. Okay, so you actually, that is the last tooth generally to fall out. So you have all of your adult teeth in a dog at about 6 months of age. So like I said, if it's a puppy who lost his teeth, there's nothing to worry about. If it's an adult puppy, so like an old puppy that lost his teeth, we just talked about how those gums heal and they do great. Now, when they do lose their canine teeth, especially in the older dogs, it is quite funny because the tongue will hang out. You don't realize that the canine teeth are what kind of holds that big tongue in that mouth there. So when that's not there to keep the tongue in the center, it kind of lolls off to a side. And we found, some of the dogs are righties, some of them are lefties. It just kind of depends. But they do really well. A lot of people talk about how their dog has a lot more energy and everything after we do those. So we got another question. Mom's cat Taffy needs some dental work according to her last visit. Mom thought it was taken care of at that time and blood work was done and no call back on the results. Okay, so that's something I can definitely look into for sure. I would certainly call and figure out. Sometimes if we do send out blood work, things like that, it is a little bit of a price break. But if we get really busy, I'll be honest, it gets a little buried, especially if it's normal. We're really good about calling back if the blood work has something wrong. But if it's completely normal blood work, we're like, oh, okay, I'll get that at the end of the day. And if we're still running at the end of the day, I'll be honest, sometimes it just doesn't happen. So if you're ever waiting on blood work results or a callback or anything from us, please call us. We don't mean not to call you. It's just something that it was probably normal and it got put off to the side to deal with when we had a minute, and we might not have had a minute. So please call us. We'll look at it right away. We've probably already looked at it. Half the time we write the notes in the computer. We just don't actually get on the phone. So most of the time, if you call in to check on those types of things, the receptionist on the phone, they'll read our notes to be able to tell you the gist of it. And if you need to talk to us, they'll tell us really quick. So I'm really sorry, Taffy's mom, but please give us a call and we will go over those blood work results. Is brushing good for dogs? So brushing teeth is good for dogs and cats, yes. As I mentioned before with the teeth brushing, if you've got a lot of tartar, or you've got a lot of buildup, you're probably not going to be able to get that off with a toothbrush, but it is definitely really helpful, keeps the gums healthy, keeps that tartar and everything from building up if you can catch it early. The best time to start brushing teeth is when they're young. And same thing is with what is the best time to start trimming nails? When they're puppies, when they're really young. You want it to become kind of one of those normal everyday things. So then it's not a big fight. It's not a big deal. A lot of times, they really don't mind it. And the teeth brushing with the doggy toothpaste, it's like a treat. They kind of like it. So it becomes one of those more experiences. And when you're trying to introduce it when they're old, sometimes they don't like it. It's new, it's different. Why are you catching me now? And if they already have dental disease, occasionally it can hurt, you know? So if you've got really bad gingivitis, and I'm like, okay, well, I'm going to get in there and take care of you with the toothbrush, and I start rubbing on those gums with the toothbrush, it can get them to start bleeding. And that can be painful. So you want to be careful when you go to introduce teeth brushing. Is it a good thing? Yes, absolutely. It's great. But you want to make sure you're doing it when the dog's mouth is not painful, okay? And that you want to go slow and introduce it so you both have a good experience with the teeth brushing. Looks like we have, my cat gets in my face close to my mouth after I brush my teeth. She must like the mint smell. Yes, actually. A lot of times they do. One of the tricks that I've used with cats in particular is if you ever need to pill a cat, you put the pill down in their mouth and you close their mouth. And if you blow on their nose, cats feel this desire to lick their nose. And it is impossible, from my experience, for a cat to lick their nose and not swallow the pill at the back of their mouth. And it tingles, I think. So when I have to pill a lot of cats or I have a difficult one, a lot of times I'll put in some really minty or spearmint gum and I'll chew that for a little bit and then I'll blow on their nose. And it must just tickle it like crazy because they definitely lick that time and they seem to like it. So yeah, cats are really into smells, particularly strong smells like that. So that I think she probably likes it. Just kind of a novelty thing for sure. So that's pretty cool. Where were we? So one of the other questions, what are kind of early signs of dental disease? So we'll kind of roll back and get focused back up. So early signs are things like I mentioned before with, maybe just chewing on one side of the mouth. If you pull the lips up, you can look and see tartar buildup on the teeth. But more importantly, as far as dental disease goes, just tartar doesn't give you dental disease. It's the gum reaction to that tartar. So the gingivitis, the inflammation, those types of things. So gingivitis is the early sign of gum disease. If you're looking in your dog's mouth, then you look at the gum right next to the tooth, okay? That'll turn like a bright red line in gingivitis, okay? So that'd be kind of your really early sign. Other things you'll see is the dog's just using one half their mouth or maybe not wanting to play tug of war anymore. Now, granted, when your dog gets older, they might not want to play tug of war anymore, but it could also be a sign that maybe the teeth are hurting if your dog isn't that old, or if they suddenly decide they don't want to play tug of war. Those types of things. If they quit using their mouth like they used to. If they start going for more soft toys instead of the hard toys when they used to not care. Those types of things are good signs of potentially something going on up there in the mouth. So things that you can kind of watch for. I get asked a lot if dental treats work. We talked about chewing. We talked about how that can break the tartar off the teeth, all of that. Dental treats work if your pet likes to chew on them. So if they chew on them for a good half an hour, they've actually broken off some tartar. If they eat them in about 5 seconds or less, then that was just a really delicious treat and they thank you very much for it. But it's not doing a whole lot for actually cleaning the teeth. A lot of our carnivores, so our dogs, our cats, we mentioned how they don't have a flat surface on their teeth, right? So they're not really into the grinding, chewing kind of that thing. They're more into the grabbing, ripping, tearing kind of chewing. So we give them this hard kibble, okay? Some of them will actually sit there and crunch it, but most of them won't. A lot of times the way that they kind of evolved was just to kind of grab their food, get it into a small enough piece that they could swallow and then swallow it. Well, we offer them kibble. It's small enough that they can swallow without having to, really break it up any or anything like that. So most of our pets will usually pick up a mouthful of kibble, crunch it maybe once, twice, and then swallow it down. And they do a lot the same with our dental treats as well. So they'll pick it up, crunch it maybe once or twice, and then swallow it on down. So it's not really chewing, it's not really grinding or anything like that. So that's why that tartar really kind of builds up. I do also get asked, well, why don't wild dogs have this problem? So they do get broken teeth in the wild, and you will see they've caught wild wolves and coyotes and stuff, and they've had dental disease in the wild as well. Usually it's triggered for one of them by like breaking a tooth on something that they bit hard, and then they start only chewing on one side of their mouth, and so then the mouth they're not chewing on kind of goes to pot. But beyond that, if assuming they don't break a tooth or something from biting something hard, the reason that they have pretty good teeth is because if you've ever watched a dog, let's say you gave a dog like a raw bone from a butcher, you know, like a raw knuckle bone, it usually has some meat, some sinew, and everything still on that bone. If you watch the dog chew it, they'll bite it, and it almost looks like they're flossing their teeth. Okay, so all that sinew, all that tendon, everything, as they kind of rip the meat off of the bone, it goes in between those teeth, and it really kind of actually flosses their teeth for them. And then they sit there and they chew on that bone, and it kind of breaks off any tartar that might have gotten built up on the outside. So they get really nice, pretty teeth from using them, flossing them, and knocking the tartar off on the sides. So that's why, but as I mentioned, there's that sweet spot, right? Between not chewing enough and getting a bunch of tartar, or chewing too much and breaking your teeth. And if you break your teeth, then you're not going to use that side of your mouth, and it's all going to go bad. So, you know, it's not really a one-size-fits-all kind of formula, unfortunately, for that. As far as kind of going back to that one-size-doesn't-fit-all, we've noticed a big difference between little dogs and big dogs. So little dogs are notorious for having bad teeth. Big dogs, usually not so much. It kind of goes back to little dogs don't usually chew much, big dogs usually chew more. But it's more than that, too. It also has to do with their anatomy. So your smush-faced breeds that are little and cute, their teeth don't have as much room to actually sit perfect, okay? So a lot of times they'll actually have crooked teeth. Very common for your pugs, your bulldogs, any of your bully breeds to have teeth that are actually 90 degrees turned from the way that they should be. And so when that happens, it's basically begging to collect tartar and everything else on there. And it's very, very prone to getting that buildup, to getting that gingivitis, getting that gum resection, getting that infection. Once you get one infected tooth, if you don't take care of that swelling, that inflammation, that infection, it spreads. And it usually ends up affecting more than one tooth. So that's why I kind of alluded to, you know, we've had several dogs with full mouth extractions. A lot of times that's how it gets started. It gets started with one bad tooth. The owner doesn't worry too much about it. Oh, he's just got dog breath. And then it kind of, the inflammation and the infection, it spreads and it affects more and more teeth until before you know it, you know, you pull open your dog's lip and it's just, you don't even see teeth anymore. It's just nothing but buildup of tartar. And we've seen some nasty ones, you know, get some pus at the gum line, those types of things. Now, that doesn't mean you're a bad owner. It means that you don't look at inside your dog's mouth, okay? And a lot of times with these guys, they don't really want you to look in their mouth. It's not like it's an easy thing to do, you know? I don't go home every night, rub my dog down, and then, you know, open his mouth up and make him say, ah, you know, you go home, you play with your dog, you love on him, and you give him kisses, and you go to bed. So dental health and being aware of that is something that I think everybody can do. And if you make it kind of your nightly routine with teeth brushing, those types of things, then you'll be looking at it and you'll be able to see that. And so it won't have to be one of those things that kind of sneaks up on you. You get another question here. A non-dental related question, but that's cool. Is there anything to give my cat that gets yeast infection in his ears often? Okay, so as far as that kind of takes us to why is he getting the yeast infections in his ears? There's lots of different reasons. You can get yeast infections because you have allergies. You can get yeast infections in cats. What I worry about a lot if they get chronic ones is that they potentially have a polyp. And we could do another kind of Q&A on polyps and interesting things that cats can get. But a polyp is a benign tumor that likes to grow in the eustachian tube, which is a tube that connects your ear to your nose. And it can pop up in different ways. So you get this growth, it's usually benign growth, in this eustachian tube, and it can either come out your ear and look like a little growth in the ear, or it can come out the nose, and then your cat's only going to be able to breathe out of one side, or it can go back down the throat, and then they'll actually have trouble swallowing. Most common place it comes out is the ear, which is why if you tell me your cat has chronic yeast infections, I always kind of wonder and worry about that. But what it will be is if you look down in the ear, you're going to see this tissue in the ear canal, and that's a polyp. Now, like I said, lots of different things can do it. We'd also see it with allergies, things like that. To answer the question pretty simply without going too crazy with all the possibilities of why your cat could get an ear infection, there's a product that's over the counter. It's called Zymox. You can pick it up, I believe, I think TSC carries it, but a pet specialty store or, of course, the internet. You could probably Amazon it. But it's a pretty good one for just your basic yeast infections. It is safe to use on dogs and cats. It's really simple to use too. You just fill up the ear canal with it. Do that once a day for about 10 days. And it should clean up if it's a basic, really simple, no complication yeast infection. It usually clears those up pretty good. If it's more complicated, let's say there's an underlying cause that we're not addressing, or it's just a really bad one, it's not going to do enough for you. But that's something you could certainly try and see if that doesn't help the cat with the yeast infection in the ears. To go ahead and kind of tie that into a dental, we did talk about how bad teeth can cause inflammation in the ears chronically if your teeth are really bad, because the ears are right up there on the face next to the teeth there. So it could be something to look into as well. Ears, eyes, nose, throat, lungs, and heart. We've all seen that get associated with bad teeth. So something to definitely think about there. Kind of staying in the cat line, there's a specific condition with teeth that cats can get, and it's called stomatitis. Okay, so stomatitis is essentially a disease process where the cat's own body seems to be attacking its own teeth. Okay, and you get horrible gingivitis with it, and the gums start bleeding, and there's lots of inflammation, and the cats are really painful. If they're having a really bad stomatitis flare-up, they're going to be drooling. They're not going to want anything. They'll actually probably stop eating, those types of things. Okay, so it's really painful. And we're not sure exactly what causes it. We're not sure what triggers it in some cats and not others. They think it might have something to do with like that underlying autoimmune condition. They've linked it to a little bit more common in cats with the feline immunodeficiency virus or the feline leukemia virus, which are both viruses that affect the immune system that they can get. But it's not clear cut. It's just associated. It's definitely not a causative correlation. It's just something that we've noticed that happens more often in them than in the other ones, percentage-wise in the population. But some cats who don't have that will still develop this stomatitis. And it is a pretty radical treatment, but the current recommended treatment for stomatitis in cats is full mouth extraction. So, and it is curative in about, I think the statistics are, I think it's about 70 to 80% effective for a full cure of the stomatitis. Occasionally though, so that would be that 20 to 30% of cats, you can do a full mouth extraction when they have stomatitis, and you'll still get gingivitis. You'll still get some gum inflammation and some discomfort. Now, the one thing I can tell you is that if that does happen with a full mouth extraction, you can go in with a gel and you can rub it on the gums, and a lot of times you can maintain it that way, and the pet can still be comfortable without having to live on steroids. The other way that we've treated stomatitis in cats is just giving them steroids every month in order to keep that inflammation down and make them comfortable enough to eat and drink. And a lot of times, we try to stretch out how often you give them the steroids, because you don't want to constantly live on steroids. It gives you a lot of bad side effects too. So unfortunately with those guys, then you have to kind of wait until it hurts too bad for them to eat, and then you give them another dose. So it's not the ideal way to kind of maintain a stomatitis cat, but sometimes full mouth extractions are not practical for either different reasons, the health of the pet reasons or financial reasons. That's expensive. It takes a lot of time to pull all those teeth, and it adds up quickly. So I think we got a couple more questions here. Let me see. Oh, there was just mostly a reminder for me that Zymox that I mentioned, it is available on our online store as well. So that'd probably be easier to...
And here.
Oh yeah, and here in the clinic. I'm sorry, I'm getting talked to from multiple directions. So the Zymox, it's really easy to find. I was just making the point that it is an over-the-counter product, so it is very safe. But we do carry it here actually because it is nice for those beginning yeast infections for ears, and it is also on our online store if you can't drive in. It's an over-the-counter product, so you should be able to purchase it without needing a script or anything. and you can get it there and just get it shipped to you. So that is actually probably an easier answer. As far as shipping times go, because I did mention Amazon, it's about the same. It's a few days, and you'll get your product. So let's see. I got derailed there. Sorry about that. So we were talking about kitties, and they get stomatitis and odd dental problems. And we've got, because kind of our best thing right now as far as treating it goes. The other thing that cats get that is pretty unique is a dental lesion called a resorptive lesion. Okay, so think of it like in a weird way, kind of like a cat cavity. Okay, so it's not a cavity in the sense that something was on the tooth, it wore away the enamel, and then it started to get infected that way. Usually it started without anything on the teeth or anything that anyone can associate with it. But it's again associated with this, the body seems to be kind of attacking its own teeth, and we're not sure why. This one we've linked pretty closely to genetics, okay? So it seems to run in familial lines. But the body starts to wear out the enamel on these teeth in a specific spot, and then it continues to kind of eat away at the tooth, and it gets those resorptive lesions. And we'll get cats and that sit there, and the tooth, you can watch it. If you look in the cat's mouth over a period of time, you'll see the tooth slowly start to kind of eat away itself until it just kind of half of it's gone, and it's just half of a tooth hanging in there. And when you do an x-ray on these guys, dental x-ray, we're looking at the root structure and all of that. On the teeth that have these really advanced resorptive lesions, the root doesn't even look like a root anymore. It's kind of turned to bone. And so now with those, we don't do full extractions where we take the root out of those anymore. We do basically, they call it a crown amputation. So we actually just take off the part of the tooth that's over the gum line to remove, again, that pain, because there really isn't any left of a tooth structure underneath there. So it's very interesting. Again, we're not exactly sure why these cats do it. We linked it to genetics a little bit, knowing that it just seems to run in familial lines. It's very unique. But while that tooth is actively resorbing, it is quite painful. Okay, so that's why we go through and we do the crown amputations to get rid of that pain, to keep the pet comfortable. Would eventually the pain go away? Yes. Eventually the cat will succeed in destroying all of their teeth, and then they'll just be completely toothless, and it'll all be over with and it won't hurt anymore. So basically we just kind of speed up that process for them, because we don't know why they're doing it. We can't stop it. We're just going to help them out by getting rid of the teeth, and then it doesn't have to hurt anymore. So I can tell you from experience still with resorptive lesions, I think there might be something else related to chronic inflammation with them, because we've had cats come in with resorptive lesions, and it isn't in all the teeth. We simply take out the teeth that have the resorptive lesions, and a lot of times the cat does fine, and we don't end up losing all the teeth. But then I'll see cats come in regularly who have those resorptive lesions, and we don't do anything about them for a multitude of reasons. And so you watch these teeth slowly disintegrate in the pet's mouth, and it seems like when we do nothing about it, all of the teeth eventually go. And so it kind of extends the time period out of that. So cats are really unique as far as dentals go. We talked about how these aren't really cavities in the sense that nothing's sat on there. Do dogs and cats get actual cavities? Yeah, particularly in our dogs, mostly more than our cats. And the most common thing that causes cavity in dogs is cheese. So our dogs love cheese, is a general rule of thumb, and cheese loves to get stuck in their back molars. And it'll sit there in those little points of the back molars there, and it'll start to eat away. Really, any milk product will do it, but the most common one we feed them is cheese. And so it'll sit there on there, and it can cause cavities on those big molars in the back. It's usually the most common I see is the big one down here on the bottom. That's the one that usually gets a cavity. So we do see cavities in them as well. And you could relate it all back to diet. They eat more what we eat. Our domesticated dogs are they're getting ready to reclassify them from carnivores to omnivores because of their way that they actually digest their food. They have an enzyme in their saliva that wild wolves don't have. that actually allows them to digest carbohydrates better. So they can get something out of the wheat and the corn and all of the other stuff that we feed them because they have the ability to digest it. Cats don't have that enzyme, and wild wolves don't have that enzyme. So they're more of your pure carnivores. So there's a debate, it's kind of fallen to the wayside. I haven't heard anything about it lately, but there was a debate to kind of switch dogs from full carnivores to more omnivores. So they have been living with us long enough that they are starting to take on our diet. So kind of another neat fun fact for you. So we do need to worry about cavities in them as well. So kind of see what else we got here. We've got, how much does pet dental cleaning cost? Whew, that's a loaded question. So I can tell you kind of where it starts, at least at our clinic. So with a full mouth radiographs and a clean and polish, you're usually around $350. Okay, it includes your anesthetic, includes all the radiographs, includes all the cleaning and polishing, and a full mouth evaluation. So unfortunately, at our clinic, we don't see a lot of just straight up clean polishes. So we usually find something. So then we get the phone call and we ask, what do you want us to do about it? And so a lot of times what we're able to do here is pull the bad tooth or teeth that need pulled. And so then the minute you start pulling teeth, the price kind of goes up quite a lot. So as when you go to pull teeth, a lot more things immediately come into play. Now I suddenly need antibiotics. I need pain meds. I need to locally block. I need to get out the drill. I need to get out suture. I need to get out scalpel blades. I need to get out elevators. I need to get out extraction forceps. A lot of stuff immediately comes on the table for equipment. Okay? And then when we actually pull the teeth, okay, how long is it going to take? It depends. If you look at an x-ray, you'll see some teeth that have been infected and have essentially a cavity, and it almost looks like it's already cutting the tooth in half, right? So I know when I go to extract that tooth, it's not going to come out whole. It's going to come out in pieces. So I have to take out a piece at a time. I have to take out this piece, and then I'm going to have to drill down more, and I'm going to have to isolate this piece. I'm going to have to take out that piece. And so it takes a lot longer. Sometimes the teeth just pop right out. So we've talked about having like a price per tooth, but the fairest way to do it is really a price per time. How long does it take? And that time price has got to include the doctor's time, 2 technicians' times to monitor the dog and help with holding things, all the gas anesthetic during that time. Our pets also get bear huggers and heating equipment and all that stuff. So there's a lot that goes into pulling teeth, and it's really hard to price that out. So I guess I can tell you, a clean polish, clean it off the table, and just evaluated, you're doing great. With full mouth radiographs is about $350. Without radiographs, you're about it's about $200 some. But if you start pulling teeth, the cost of it gets up there really high. Average that needs teeth pulled here, usually it's more than just 1 or 2 extractions. Usually we're talking multiple extractions because it's a bad mouth. It's not unusual for us to get up to like $800-900. So, and it's just time. Time-wise, how long does that take me? The longest dental we've ever had, and this is where we kind of cut off our dentals time-wise, is 4 hours. So we were in surgery for 4 hours pulling this dog's teeth. It was a very large dog that we came up to our time limit on. We did not get to finish everything we wanted to do, but we ran out of time. We didn't want to leave him under anesthetic any longer. He needed to wake up. So we sent him home, and he ended up coming back at another time to finish up all the work that he needed done in his mouth. So if we run into a time limit, that's what we do. Usually, are we able to finish everything we need to finish? Yes. But we do cut the time at about 4 hours. And if we're not able to finish, then we'll have to come back another time. With that in mind, too, because as I said, most of our dentals are priced time-wise. If, we're coming in and you give us a price, hey, this is what I got. I can't go over that, but I want as much done as I can. We'll prioritize. We'll get the worst teeth first, okay? And we'll keep an eye on the time, and we'll stay within your price, okay? So we try to work with you, but we want you to be very aware that if you give us something like that, yes, we will work with you and everything, but there's a good chance we might not finish. And that stuff does happen. And so you just prioritize worst teeth first. The whole goal of everything we do here is to make the pet comfortable, to make the pet pain-free as much as possible. Okay, so we prioritize and we try to work with what we can. Everything in life is just doing the best you can. So my phone's blowing up. We got a couple more questions here. She says, thanks for the info. Can you give us some info on pet food or nutrition? So she just kind of a basic question about nutrition. What should the pets be consuming? Interested in healthy cat food. Okay, so what should they eat? That's another loaded question. So basically, as a kind of a cheat, I'll tell you to just kind of stick to one of your name brand companies. So your Science Diet, your Purina, your Iams, your Royal Canin, they all do a lot of research, okay, and behind their diets. Now, there's a couple little caveats to a couple of these brands, from in my own opinion. So your Iams brands, okay, they have multiple lines. Their more expensive line is Eukanuba, and they do actually put a little bit more research into their Eukanuba line. So if you like that line, go for Eukanuba over Iams. Science Diet, all their lines are they only have one line. It's all the same. Same with Royal Canin. Purina is your other one that has multiple lines within the brands, okay? So your Purina Dog Chow, it's pretty basic stuff, okay? Your Purina Pro Plan, it's actually a little bit better, okay? As far as kind of the catchphrases that everybody talks about with nutrition, grain-free, high protein, all of that, grain-free, I can tell you, is just a fad. Okay, I already mentioned that dogs actually have the enzyme to digest grains, so they really don't need a diet that's grain-free. They get stuff out of those grains. And as far as high protein, well, if you're really running your pet, okay, and you're exercising them a whole lot, maybe go for the high protein. But most of our pets are like us. They're couch potatoes, okay? So they don't really need the high protein. They don't need to be drinking muscle milk, every day and taking the huge protein shakes. They're not out running the Olympics or doing bodybuilding, those types of things. So you don't necessarily need to go for high protein just for your average dog that's hanging out with you. If you have a real athlete, then absolutely, get them the high protein. But as your basic dog food, you don't really need that. Cat food, cats, they always need a little bit more protein. Any cat food you get is going to have more protein when compared to a dog. So do you need to go specifically for the high protein cat food? No, you probably don't. Most of the cats I see, honestly, are overweight. So a healthy cat food or a good cat food is one that's going to keep them at a healthy weight. And that is more what I'm concerned about. I'm not going to tell you, look at the ingredient list and rank it this way, this way, this way. This should always be the first ingredient, because that's not the case. What needs to happen is you need a balanced diet, okay? So stick with a brand that you trust, one that you like, one that does research behind it. Most of your off-brands and stuff at your stores are made by one of those 4 big companies. They're just labeled under a different name. So if you want to try to research into that, you can look into that and see. But those are kind of your 4 big giants that kind of make everybody's food. It's just what label do they put on it and what spin are they trying to pull on it. But unless your pet has a real specific dietary requirement, has, known food allergens, gastroenteritis, those types of things, you don't really need a real special food. Any nice balanced food will do a good job, particularly for cats, because cats are always a little bit of a different story. The other recommendation I do have is stay away from the dyed foods. Something we see pretty common is the dyed foods. So most common one is Meow Mix. A lot of cats do really well in Meow Mix, but it has a lot of dyes. And we actually see quite a lot of cats come in for vomiting, GI upset. And if we just switch from Meow Mix to one that doesn't have all those dyes in it, you're good. It usually stops the vomiting. So that would be something. If you have a cat, I know vomiting happens in a lot of cats, that's vomiting, that's a really easy switch you can try to make. Just kind of veer towards the food that doesn't have dyes in it. It'll look really boring, but if you think about it, your cat's actually colorblind anyway. They don't care what it looks like. that was all for us. That's why they color coded it. All right. So it looks like we're running up on time. Hopefully that kind of helped you with the nutrition question. Nutrition is really hard, and we could do one of these just on nutrition. So kind of as a cheat for you, stick to a major name brand. Try to avoid dyes and cats, and don't worry too much about all the marketing ploys. Okay, you can feed your dog grains. It's okay. You don't always have to have the super athlete food, because most of our dogs just kind of hang out with us anyway. But kind of to veer back to our dentals, dentals are important for overall health. It affects eyes, it affects nose, it affects ears, it affects heart, it affects lungs. It plays a lot of roles, and it does affect, pain-wise as well. So it plays a lot into overall comfort of the pet, overall health of the pet. It's becoming more and more of a big deal because our pets are living longer, and they're living with us, and they're doing more with us. And so we're finding these issues, and the whole goal with all of this is to keep them happy, keep them healthy, and keep them pain-free. Okay? So with that, I'll say thank you for watching, and I hope you all have a wonderful night. We'll be doing this again next month. I'm not quite sure what the topic is going to be for next month, but keep your eye out on our Facebook post. I'm sure we'll post what it's going to be about. Be sure to send in your questions. And also, if you have any suggestions for things you'd really like us to talk about, for example, if you want to deep dive into dog foods and nutritions and my kind of take on it, let us know. Or if there's something else that you really want us to dig into, again, let us know. So thank you, and I'll see you all later. Oh, the button didn't work.